all you have to do is sway with me, Sarah.
Perfect. I love it. I'm feeling very at peace right now.
Can you sing though?
Oh no. That's even worse than the dancing.
So if you don't know, my nurse practitioner, Sarah Quinn.
Hello.
She's been helping me with my hormone therapy for 10 years now.
Can't even believe it. 10 years. Wow, time flies.
Time flies. And as we were saying earlier, I actually look younger now than I did 10 years ago.
I definitely think so. You're aging backwards.
Thank you. And I think that's all about longevity. And you're hearing me talk about this more and more. I'm about to hit 50.
Woo! Exciting.
Everybody take a deep breath.
I think it's exciting.
It's exciting and it's scary because everybody, you know, and people are so negative, but they're like, oh, 50, after 50.
Yes.
But this is the thing, with longevity and with everything that we've been doing over the last 10 years, I'm saying, okay, why do we have to let ourselves decline when we can keep our hormones and anti-age and really work on longevity? And there are so many things out there now that are totally available to you, like hormone therapy. And let me just say, there is nothing more important than your hormones.
It's pretty important. I mean, it regulates, your metabolism, your body function, your, some aspects psychologically, I mean, emotions. I mean, really it's intertwined in everything. And
I just had a meeting with an endocrinologist and we were talking about it too. You know, back a bunch of years ago when my mom was on hormone therapy, they scared everybody with a study out of U of A or Tucson, right? That, by the way, they've retracted all of it. And back then they scared everybody and said, oh no, it causes cancer. No, listen up. The benefits of hormone therapy way outweigh any of the risks.
Yeah, it in fact helps prevent so many things such as metabolic syndrome, Alzheimer's, heart disease, diabetes. I mean, there is nothing better you can do for your health.
Your bones?
Yeah, bone health, yeah, and just having vitality and enjoying your life.
Energy, libido. Hey, listen, you know what? Your marriages, if you're not wanting to have sex with your husband, I can't tell you how many women say to me, I just have zero libido. I don't want to. Well, that's not good enough. No. And men too, by the way. Men too. Men need hormone therapy just as much as women do.
For sure. And I think, you don't necessarily have to have all the symptoms that you would find looking up online. You could have one of them, you could have 5. Everyone's different. Or you could also say, hey, I'm in my mid-30s and I want to be as vibrant as possible.
Stay ahead of the game.
Yeah, stay ahead of the game. Let's see, what do your labs say? What's going on? Where do you want to be? Do you want to age backwards or forwards?
And so it's not just hormone therapy. And by the way, the person that you go to for hormone therapy is almost more important than the hormones, because if you're getting hormones and you're not getting the correct dosage, it can be bad. Same with now, all these weight loss drugs, you gotta know who you're going to and what you're being prescribed.
Yes, I mean, yes, you can find anything online. You can always find something cheaper from somebody, but going to somebody who has proven results, the proven studies to keep you where you want to be, anticipate issues, or be able to adjust things as needed to make it as best an experience as possible. It's really invaluable.
And you're pretty much doing this. This is like your full-time business. So a lot of doctors have picked up hormone therapy because it's a cash cow, and it's a great way for them to make a quick buck, but they don't necessarily know really the ins and outs of it. So anybody can prescribe it. So important to get it dialed in, and that's where Sarah and I really connected, because I had seen 5 different doctors before meeting Sarah, and I was really at the point where I wasn't interested in hormone therapy at all until we started talking and the light bulb went on with what you had to say. All of a sudden it made sense. We do not do pellets. I loved my pellets until I didn't love my pellets, and that was the moment.
I hear that so often.
Right, like it was going along, and I'll tell you that the negative of a pellet from the get-go was the fact that I had a cut. They cut my butt. I have little scars all over my butt. Number 2, can't work out for 2 days. Okay, well, you know me, that didn't work. I now have a troche that melts under my tongue every morning. At any point, if my life gets more stressful, less stressful, you can adjust it depending on how I feel.
Exactly. Our bodies are always changing with how much our bodies are producing hormone-wise. Stress really affects it, toxins, not sleeping. And so there's going to be points where you need to change dosages or do adjustments.
Shit happens. Let's just say it. Shit happens. Today you're going along, everything's fabulous, and then boom, something happens at work, something happens with your kids, something happens with your parents, and then all of a sudden stress and cortisol and all of this. So do you think that your hormone that you put in your tush 3 months ago is going to be this? It doesn't stay the same.
No. Or if it's too much, you can't take a pellet out. You're kind of stuck with
That's
what's
where I was. And that's when I knew this is not for me. So I love the way you do it. It's so quick and simple. You don't even have to live in the state of Arizona to work with Sarah.
We are always available. We do a concierge model approach. So we try to make it as easy as possible. That means phone calls, texts, emails.
Listen, I'm out of town and I'm like, Sarah, I need an antibiotic. Boom.
Yeah. The reason our patients have such good results is we really try to be on top of stuff as much as possible, and also realize that everyone's an individual. There's no set protocol that I use. Everyone's different, and so we're going to find the perfect dosage based off of your symptoms to give you the best results.
Longevity, health, wellness, if you want your body to stay the way you want it to, if you want to have the energy and live the life that you want, start with your hormone therapy, add on the peptides, get into the gym, all of these things. It's every little piece that adds up. So it's not just one thing, right? Sarah can't do all of it for us.
Right.
But with her help, she's going to put you on the right track.
Yeah, exactly. Give you the tools so that when you put the energy out there, you're going to see the results that you're looking for.
And guess what? When you start feeling more energetic because you're on hormones and your body's feeling more like itself, you're able to do more. And you'll find yourself in the gym more. You'll find yourself getting better workouts. You'll find yourself having more energy to go on dates and be better for your partner and all of those things. It's incredible. I can't say
Best thing you can do for yourself.
And 10 years, if that doesn't say it all.
That's crazy. Yes. Like we've always said, come get some labs. Let's talk about it. Information, knowledge is power. Start from there. Yeah.
All right. You guys saved 10% when you mentioned me. So what are you waiting for? ArcadiaWellnessCenter.com. She's waiting for you.
Yes.
Bye, guys.